Hi all, welcome to my presentation. I am Rakhi Mohan, MSW second year student of Loyola College of Social Sciences, Srikaryam. My presentation is on the light of group discussion which was done in our class. For the group discussion, the class was divided into 5 groups and each group was given a question. They discussed their respective topics in the group and prepared a summary write-up, which included comments from the individual students and a consolidated commentary. For the group 3, the question is the difference between the casework and related profession, the overlapping areas and how do we avoid it. Casework, counseling and psychotherapy are interrelated profession. Caseworkers consist of process that help to develop the personality of individual through meaningful adjustment between themselves as well as their social environment in which they have been brought up and socializing till this moment. Where counseling is a form of talking therapy, it is a process where an individual, couple, or family meet with a trained professional counselor to talk about issues and problems that they are faces in their lives. This involves an act of helping the client to see things more clearly, possibly from the different point. Psychotherapy, it is a general term that is used to describe the process of treating psychological distress and mental distress. During this process, a trained psychotherapist helps the client to tackle a specific or a general problem, such as particular mental illness or a source of life stress. Social caseworker studies whole individual for the giving of a concrete help. Help is provided after considering and analyzing client social, psychological, economical factors. Client has a right to select his own course of action or make use of available resources. It deals with a psychosocial problem. Caseworkers are recognized by its aims of social betterment and its method of individualized and differential intervention. Now we are moving on to counseling. It is a process of assisting and guiding person through a relationship of reasonable trust, especially by a trained person on a professional basis to resolve especially personal, social or psychological problems and difficulties. It is a process that occurs when a counselor and a client meet face to face in order to identify the factors that cause crippling feelings and very stressful behavior for the latter. Counseling can enable the client to focus on feeling, experience, or behavior with a goal to bring about positive changes. Counselor may encourage the client to examine part of their lives that may have found difficulties or impossible to face before. Effective counseling creates clarity about the problem situation. It helps the client to explore the choices before them for bringing about the necessary positive changes in their attitude and behavior. The ultimate aim of the counselor is to enable the client to make their own choices, make their own decision, and act upon them willingly. Psychotherapy is a form of psychological intervention for problems of an emotional nature in which a trained person deliberately establishes a professional relationship with the client with the aim to remove, modify present symptoms or mediating distributed patterns of behavior and promoting positive personality growth and development. Depending on the approach used by the therapist, a wide range of techniques and strategies can be used. Almost all types of psychotherapy involves developing a therapeutic relationship, communicating and creating a dialogue, and working to overcome problematic or stress related to thoughts and behavior. It is to change the behavior and alter the attitude of the maladjusted person towards a more constructive outcome. Psychotherapy can perhaps be defined as a process in which a therapist helps the client in the process of reorganizing his or her personality. Now we are going to discuss about the overlapping areas of casework with the counseling and psychotherapy. It is a common view that there is a lot of overlapping among the three entities as they make use of the similar theoretical framework of the reference, the same training materials, books and resources. This is particularly true when courses are based around the same theoretical school of approach. For example, person-centered of psychodynamic. A person may reach a professional status, either a person-centered counselor or a psychotherapist, yet their fundamental differences are unclear. Overlapping areas between social casework and the counseling. Both the social casework and the counseling have the same objective. They attempt to help the individual who have some problem. Their process necessarily involve the individuals in such a manner that the capacities of the individuals are enhanced so that they can help themselves and solve their problem themselves not only at the present but also in the future. Casework and counseling deal with the similar kinds of problem. Both make an attempt to address the problem, client's inner problem, which exert pressure on their social functioning, and which are mostly psychosocial in nature. The effectiveness of these two approaches depend to a great extent on the strength of relationship between casework and the client. Both the approaches believe in the intrinsic worth and dignity of a person with a problem. Casework and counseling view the person with a problem as an individual who has the right to get help and recognized as the person of the human worth and dignity. Next, casework and counseling follow a common principle. Both accept the person as he or she is and provided him or her with the opportunities for self-expression. Here we are discussing about the overlapping areas of casework and psychotherapy. Both the casework and psychotherapy help the individual who come with the emotional problems and painful situation. Both the approaches make effort to put the client at ease and create an environment for him or her to express his or her feeling freely. They share the same values of individuality, dignity of the human person, and respect for the client. They make use of interview as a technique in the therapeutic process. Both the casework and psychotherapy believe in the client right to self-determination. The two approaches recognize the role of emotional and pre-conscious or unconscious process at work in the client which influence the client thought, feelings, and behavior. Now we are discussing about the clarity in browsing the three interrelated professions. Due to overlapping areas, the role confusion occur. The practitioners are also have this confusion in the early stages of their practice. Clients may also have this doubt. The social worker should be well aware of his or her role and distinguish it from the other profession. While psychotherapist is usually a trained psychiatrist who handle mental disorders which have met diagnostic criteria, the counselor is usually a practitioner with a psychology or counseling related degree and handles behavioral or adjustmental problem of the client. The caseworker helps the client to solve problems in their social functioning by helping them adjust to their social environment and make best use of resources around them. Psychotherapy and counseling are costly, and many people in our society cannot afford this. A caseworker who works as a part of an agency is more accessible to the poor and provides them psychosocial support. Then we are moving on to the group 4. Their question is critically evaluate the present state of casework in the West and in India and suggest the way forward. The group members are Krishnendu, Krishna, Jasna Jacob, Jins Joseph. At first, we are going to look on the caseworker practice in the West. In the West, the designation of social caseworker is common. The Social Services Department and other agencies employ a considerable number of caseworkers. Caseworkers have a recognition and authority and a clear job description. Caseworkers are also usually associated with an agency which has ample resources to assist the client in solving his or her problem. Case laws are specified, and a caseworker has supervision and clearly documented intervention. Western clients have internalized the role of caseworker. In India, the caseworker has to perform twofold role. On one hand, he or she has to handle traditional caseworker situation where the individual adjustment to his or her reality are disturbed due to internal or external strain. On the other, the caseworker role is to help an individual to reach a new level of integration by introducing new ideas and new ways of living. Social caseworker practitioners in India view the concept of the casework differently. According to them, social casework can be practiced successfully in a democratic society only. In the context of the social casework practice, democracy implies freedom and self-fulfillment. In the Indian context, the concept of the self-fulfillment and the self-expression go in hand with the concept of the conformity to the group norm. In India, most common application of the caseworkers relation to work with the children and the probation. School, medical and the psychiatric setting too have the casework practices. But there is no organized casework practice with the specified caseload, supervision or reporting parameters. The social caseworker is often does not have a resource base to fall upon. Also, Indian clients have not internalized the concept of a social caseworker. In this slide, we are discussing about the suggestion to acquiring clarity about the three interrelated professions. In Indian culture, where a family is considered as a basic social unit and it is ready to support the individual in every kind of situation, it becomes vital that caseworker is geared towards the concept of duty. This does not mean that authoritarianism should prevail and people would regard themselves as powerless. Awareness needs to be generated about the benefit of the organized casework practice in traditional social casework practice setting. Also, a resource base of the different kind of resources should be developed and listed support a group materials, monetary and professional volunteer resources. The importance of the active approach cannot be denied. It may be a result of our Indian culture and tradition. Traditionally, Indians have learned to value the words of the elders or are used to being told by our seniors what is right or what is wrong. So rather than asking in an indirect way what is the best course of action, the client need to be actively facilitated in the decision making process. Also, resource coordination should be also be established. A tradition of reporting and supervision should be ensured. Here we are moving on to the group 5. Their question is analyze the application of the theory learned in the casework to cases in the field. Discuss their challenges and the way forward. The group members are Punya Pradeep, Tony Thomas, Kavya Shaji, and Devika Rajan. The social worker trainees, through their concurrent visit, was able to integrate classroom theories into the caseworker practice. Since relationship forms the basis of the social caseworker, the trainees focused on applying the characteristics of relationship, which include concern for others, commitment and obligation, acceptance and expectation, empathy, authority and power, genuineness and congruence, and rational and irrational elements. Here we are going to discuss about the principles which are used in our fieldwork practice. The trainees also try to incorporate the principles of the social casework into practice. At first, the principle of self-determination. It discussed about the while engaging with the client as the main objective of the trainees was to intervene into the problem of the client by making them able to find solution for their own problem. The trainees was able to accept that essence of the being human is having problem, making choices and participating in shaping one's own destiny. The trainees also practice the principles of individualization and acceptance in different contexts during the casework session. In this slide, we are discussing about the tools, techniques, and skill which are used in our casework practice. At first, Characteristics of the social casework relationship, such as concern for other, was easy for the social worker trainee to practice in the field as the trainee had a skill in rapport building, empathy, communication skill, etc. Also, the trainee was sincere enough so that the trainee expressed a sense of responsibility, care, and knowledge for other human beings. During each session of the social casework, the trainee was able to integrate the tools, techniques of the social casework. The main skill exhibited by the trainees include the interviewing skill, like listening to the client by paraphrasing and summarizing the problem shared by the trainees. Observation was purposefully carried out and it was effective through home visits so that the trainee was able to know about the client and their environment, and also it has a great role in molding the life of an individual. Documentation skill were made use of for preparing the reports, and the trainee was incorporating the professional learning by analyzing the daily fieldwork experiences. Attending to the problems of the client, the trainee realized that the issues of the client are not only caused by the individual resident but also are fueled by the factors related to the community, family, etc. Here, the trainee, instead of focusing on the individual alone, adopted a person and environment approach. Also, in the intervention phase, the trainee adopted the method both direct and indirect. The techniques learned in the counseling psychology were of great use to the trainees. The skills used by the trainee were active listening, problem skill, paraphrasing. Also, the trainee was also careful in adopting solo technique, which means that S stand for the sit squarely to the client. Also, open posture, leaning forward to the client, good eye contact, and a relaxed body posture of the caseworker. In this slide, we are discussing about the challenges faced by the social worker trainees in their casework practices. At first, the trainees had certain prejudgment about the client by considering their environment. The limitation was regarding the person, as in the worker was more concerned about the past experiences and present difficulties. Next is place was a limitation for the trainees, as it was difficult for the trainee to engage with the client in uncomfortable atmosphere. Lack of privacy was a serious limitation. Certain time, family members were sitting along with the client when the session were going on. The caseworker on such occasion failed to ensure the privacy. Motivating the client was also a great task, as the client accepted the situation as a fate and felt hopeless in solving the problem. So, it was important for the worker to motivate the client towards the action. Lack of congruence of the worker was something that should be taken care by the caseworker. Lack of resource list or resource bases also found to be a great limitation in the practice. Next is often fieldwork report did not reflect the application of the theory effectively. The way forward suggestion to overcome these challenges is the trainees need to make a more conscious application of social casework theory in their fieldwork practice, and the fieldwork report should be reflect the purposeful application of the theory. Together, the students and teacher can strive to create a resource base. It is all about the group 3, 4 and 5 group discussion. Thank you.